What's up, you guys? It's your fellow X-ray tech peep here, Miguel, giving you the knowledge you probably won't find out there on the internet. And today we're covering how to do morning ports more faster and efficient. Okay, so if you don't know who I am, essentially I work at a level 3 trauma place, night shift. So you kind of understand there. So I have noticed that our morning portables will pop up about 12:30, right? Get a little stack of list. It could be between 15 on a good night, 30, 40, and it all depends. You get a little list. So when they pop up, you kind of have understanding, okay, certain floors have this, certain sectors, like there's x-rays done at certain times, or like if they're going to surgery. So you kind of get an understanding and get into a rhythm of how certain stuff gets done. But then what you got to throw in the mix is the flow of the ER and then codes on the floor. For instance, if you know that your morning ports are going to pop up at 12:30 and someone calls in, oh, we need a code stat x-ray, and it's like 12:25, and you're like, well, okay, we gotta go do that, and it's on, like, let's say the ICU. You're like, okay, well, if I wait 5 more minutes, my list can pop up, and now I can go in there and do the stat and then do all these other x-rays that were already up there, because there's no point of you going back and forth. You gotta work smarter sometimes. Or think ahead of how stuff, or like we usually just clump them all up and then on one shot go knock them all out. Sometimes you can't do that because the ER will be propping, there'll be trums, you got to kind of split up and one do one floor, one do, it kind of all depends on the flow of the work of the facility and how stuff they like to be done, you know. Or you kind of get an understanding of how the other people will work. Because, like, for instance, our biggest, like, not waster, but, like, they'll get in their way, lab people, respiratory people, or then, like, the nurses will be in the room with the patients. And we notice at certain times, the blood people will go lab, and they'll be there when we wait. So you kind of have to get an understanding when the other people go, so you kind of work around that. And you kind of get an understanding where all the rooms are, and you kind of have a certain flow, and you can kind of like avoid interacting with them and increasing your time of getting the x-rays done and certain stuff like that, you know? And then if you have a good like repertoire with other workers, they can be like, well, you're doing all these x-rays. They'll be like, hey, yo, we added certain x-rays on this patient. And you're like, oh, well, that's nice, because now I don't have to come back because they told you. Because some people, or doctors or nurses, they won't tell you that there's more x-ray orders. Sometimes they think, you know, depending on your facility, you might have a phone that shows up your orders. And if they put them in, which now I have it, and now we can kind of avoid that, but before we didn't, and that was a big problem that pissed us off. And yeah, it's been your boy Miguel. See you in the next one.